Well, everybody's hurt their finger, whether it's competing in sports or everyday activities, maybe around the house. And even though it's a pretty common injury, it can often be misdiagnosed. Dr. Michael Kim is joining us live now to tell us more. Good morning, Dr. Kim.
Good morning.
You see a lot of these. You're a hand specialist, actually.
Yeah, actually, I brought this topic up. I haven't talked about it in a while because a friend of mine who's a doctor actually had this and didn't recognize it. So I think
Really?
it'd be an interesting thing to talk about because many doctors don't even realize what this injury is.
Wow. Okay, so how do you know if it's a very serious injury or if it's something that's just your everyday
Well,
problem?
this is also called baseball finger, mallet finger, and basically it's the most common closed extensor tendon injury of the finger in the sports. And often with jam basketball, jam baseball, even people just making their bed and jam their finger, you can see that tendon on the top is very thin and it gets attached from the bone. So then you end up with a bent finger, very sore, swollen, and bent. And a lot of people walk around and think it's just bruised and there's nothing wrong with it, but actually the tendon has ruptured. So this actually sometimes can be a little bit debilitating because what happens is you end up with a flexion contracture of the distal joint, and sometimes you can end up with a little bony fragment called a bony mallet. So if there's a bony mallet, you have a chance of arthritis and pain down the road. So if you do get a bent finger and swollen, you probably need an x-ray and evaluated by a hand surgeon to see what the best treatment would be. Unfortunately, the best treatment for these is external splinting. So if you get this bent, swollen finger and it's been a couple of weeks or months, you can go into your doctor and they'll just order one of these little splints to wear, and you have to wear it 24/7 for 8 weeks. So
8 weeks.
6 to 8 weeks. So basically, even when you take it off to wash your hand, you have to keep the finger straight and then we'll put it back on. Once you bend it, you start the whole process over again.
Oh my gosh.
So it's very time consuming. A lot of doctors and dentists, if they get this, they have to have an internal pin put in, because it's really hard to wear a splint with gloves.
Well, sure.
So occupations like a dentist, I've done a couple of dentists where they get this problem and they end up, we put a little pin through the skin, leave it in there for 2 months. They can still wear gloves and then take it off and then their finger is straight again.
What's your odds for full mobility after you've had an injury like this?
I think most people get most of it back, usually not completely, whether it's a little loss of extension or sometimes a little stiffness. But fortunately, most people do pretty well. And some older patients, without fixing it, are okay having a bent finger. But most of the younger people that I deal with, it's really important to have that function of extending the finger, be able to open their hand.
I would assume you would want to go in sooner rather than later if you do have this type of an injury.
Yeah, some people talk about delayed treatment, but usually after several months, the treatment is not helpful anymore, so people end up with a permanent disability.
All right, Dr. Kim, thank you so much. We appreciate it as always.